Okay, so you sent us this really interesting set of articles all about vision problems and eye conditions.
Yeah.
And we're going to try to dig into all that today and pull out some of the most important stuff so you can really understand what all these things are
Yeah.
and how they might affect your vision.
Yeah, and I think it's really interesting. You have articles that range from like common things like blepharitis and conjunctivitis,
Right.
which, a lot of people experience, to some more serious stuff like glaucoma and retinal detachment.
Yeah, and I think it's helpful too to kind of see all these different things laid out because you can start to kind of connect the dots between,
Right.
why your eyes are bothering you and what might be going on.
Exactly. And understand kind of the basics of each. And then you can get a bigger picture of eye health.
Absolutely. And you mentioned to me before that you wanted to get a good understanding of this information, but you also wanted to do it efficiently.
Right.
So we're going to kind of give you the direct route through this stuff so that you can understand it and feel like you've learned something without getting too bogged down in the details.
Yeah.
Okay, so let's jump right in, starting with glaucoma, which is often called the silent thief of sight.
Right. So glaucoma is a condition where there's usually an increase in the pressure inside the eye.
Mm.
And you can think of it like a basketball that needs a certain amount of air pressure to stay firm.
Okay.
And in glaucoma, the pressure inside gradually gets too high. And what's important to understand is that increased pressure can slowly damage the optic nerve.
Mm.
And the optic nerve is like the cable that connects your eye to your brain, carrying all the visual information.
Right.
So that cable gets damaged, then you can unfortunately end up with blindness.
Wow, so pretty serious stuff. And what makes someone more likely to develop glaucoma?
There's a few key things that increase the risk. So age is a big one, especially for people over 40.
Okay.
Ethnicity can also play a role. Certain groups have a higher chance of developing it.
Okay.
Interestingly, a history of migraines is another factor, and so is heart disease.
Why would that be?
Well, when you think about it, heart health affects blood vessels throughout the body, including those tiny ones that supply the eye.
Right.
So that connection kind of makes sense.
Makes sense.
Family history of glaucoma also increases your risk.
Mhm.
And even long-term use of contact lenses and certain medications, particularly anticholinergic drugs, have been linked to a higher likelihood.
So there's like a good number of things to be aware of.
Yeah, a lot of different things can contribute.
Okay, now you distinguish in your notes between PAGG and PAG. So what's the key difference there?
Yeah, that's a really important distinction. So primary angle closure glaucoma, or PAGG, usually comes on quickly and often involves severe eye pain.
Okay.
To understand this, imagine the eye has a drainage system to get rid of fluid like a sink has a drain.
Okay.
The angle where the colored part of your eye, the iris, meets the clear front part. The cornea is where this drainage happens.
Okay.
In PAGG, this angle can suddenly narrow or close, blocking the fluid from getting out and causing a rapid buildup of pressure. It's like the sink drain suddenly getting completely blocked.
So that explains the quick onset of the pain.
Exactly.
Okay, and how is PAO different?
So primary open angle glaucoma, or PAOG, is much more gradual. The drainage angle is still open, but the fluid doesn't drain out as efficiently over time. It's more like that sink drain slowly getting clogged with debris.
Okay.
Leading to a gradual increase in pressure because it happens slowly.
Yeah.
People often don't notice it in the early stages, and they can start to lose their peripheral vision without realizing it.
So that's why it's so insidious. It's just kind of happening in the background and you don't even realize.
Right.
Okay, so what is some general signs and symptoms, or SNS, that might make someone think they have glaucoma?
Yeah, so the SNS can include eye pain, redness, seeing halos or rings around lights, and unfortunately vision loss, especially as the condition progresses. And as we mentioned earlier with risk factors, it's really important to know that anticholinergic drugs are contraindicated, meaning they should not be used by people who have glaucoma because they can sometimes make the condition worse.
Got it. Okay, let's move on to age-related macular degeneration, or AMD.
Okay.
So what exactly is the macula and why is its degeneration such a big deal?
So the macula is a small but incredibly important area in the retina at the back of your eye. Think of your eye as a camera.
Okay.
The retina is like the film or the digital sensor that captures the image, and the macula is like the high resolution center of that sensor.
Okay.
It's responsible for your sharp central vision, what you use to read, recognize faces, and see fine details. AMD is when this macula starts to deteriorate, leading to a gradual loss of that central vision.
Okay.
So people with AMD might start to see blurry areas or even blind spots right in the center of what they're looking at.
Wow, that sounds like it would really impact your daily life.
Absolutely.
Now, I saw a mention of an Amsler grid in your notes, so what's that?
Yeah, so the Amsler grid is a simple pattern of straight lines that eye doctors often use to help diagnose and monitor AMD. So you look at the grid, and if the lines appear wavy, broken, or distorted, It could be an early sign that there are problems with the macula.
Okay.
It's also a way for people to monitor their vision at home.
And just like with glaucoma, there are different types of AMD, right? Dry and wet.
Yes, exactly. So non-exudative or dry AMD is the more common type, and it tends to progress slowly, often over many years. It's characterized by the buildup of yellow deposits called drusen underneath the macula.
Okay.
Think of it like tiny bits of wear and tear accumulating over time.
Okay.
Exudative or wet AMD is less common but more serious. It involves the growth of abnormal new blood vessels under the retina that can leak fluid and blood.
Okay.
This leakage can cause rapid and significant damage to the macula and lead to vision loss within months.
Wow, that's a big difference.
Yeah, so dry AMD is like a slow erosion, while wet AMD is like a sudden leak causing rapid damage.
Okay, and this is a pretty big deal in terms of health concerns, right?
Absolutely. Your notes point out that AMD is the most common cause of vision loss in the United States for people aged 50 and older.
Wow.
And it's caused by a combination of things, genetic factors that you inherit, behavioral factors like smoking and environmental influences over time.
Okay, so lots of things going on there. Next up is papilledema.
Okay.
That sounds pretty technical, so what's happening there?
So papilledema is essentially the swelling of the optic nerve due to increased intracranial pressure, or ICP, which is the pressure inside your skull.
Yeah.
High intracranial pressure is sometimes abbreviated as HNO.
Okay.
What's really important to understand here is that papilledema itself isn't usually an eye disease, but rather a sign that there's increased pressure around the brain and it requires immediate medical attention.
Okay.
It can be a symptom of serious conditions that cause dangerously high pressure within the skull.
Right.
Think of your optic nerve as a cable coming out of the back of your eye.
Okay.
If the pressure around your brain increases, it can push on this nerve, causing it to swell. It's like if you have a kink in a garden hose, the pressure can build up behind it, causing the hose to bulge.
Okay.
Papilledema is a visible bulging of the optic nerve at the back of the eye due to similar pressure.
Okay, so some serious stuff. And what are the SNS to watch out for?
Yeah, so the SNS can include headache or HA nausea and double vision. And when an eye doctor examines the back of your eye, a key finding is an unclear or undefined border of the optic disc.
Okay.
That's the area where the optic nerve connects to the retina.
Right.
So if a doctor sees this, it's a red flag and needs immediate medical investigation to find out what's causing the increased pressure.
Okay.
So it's definitely a medical emergency.
Definitely something you wouldn't want to ignore. Okay, let's move on to a more common issue, blepharitis.
Okay.
I've heard of that before.
Yeah, so blepharitis is basically an inflammation of the eyelids. You might notice that the edges of your eyelids look a bit greasy, and there can be crusting or scales stuck to your eyelashes, especially at the base.
That doesn't sound very comfortable.
No, it can be quite irritating.
So what are some other SNS that someone might experience?
Yeah, the list is actually quite long, which shows how irritating it can be.
Okay.
People can have red, watery eyes, feeling like there's something gritty in their eyes, a dry sensation, a burning feeling, itchy eyelids.
Wow.
Eyelids that look red and swollen, flanking skin around the eyes, crusty eyelashes, particularly when they first wake up. Increased sensitivity to light, which we call photophobia, excessive tearing,
Okay.
even abnormal growth of eyelashes or loss of eyelashes.
Wow. So quite a range of potential irritation.
Yeah, so it can cause quite a range of annoying symptoms.
What are the causes of blepharitis?
So several things can lead to it. Bacteria that normally live on our skin can overgrow and cause inflammation.
Okay.
Tiny mites called Demodex that live in hair follicles and oil glands of the eyelids can also be a trigger. And it can also be associated with skin conditions like acne rosacea, which causes redness of the face, and seborrheic dermatitis, which causes scaly patches on the scalp and skin.
Okay, let's shift gears to retinal detachment.
Okay.
The name itself sounds kind of scary.
Yeah, it is a serious condition. So retinal detachment is when the retina, which is the light-sensitive layer of tissue at the back of the eye, pulls away from the layer underneath that provides it with blood and nutrients.
Okay.
Think of it like wallpaper peeling off a wall. If the wallpaper detaches, it can no longer function properly.
Right.
Similarly, if the retina detaches it, it can't send visual signals to the brain effectively.
So what are some warning signs that might indicate a retinal detachment?
So key warning signs include seeing photopsia, which are sudden flashes of light or streaks in your vision, like seeing snores after bumping your head. A sudden increase in floaters, those little specks or cobwebs that drift across your field of vision,
Right.
especially if there's a sudden shower of them. And noticing a shadow appearing in your peripheral or side vision, like a curtain beam drawn across part of what you can see.
Wow.
It's really crucial to seek immediate medical attention if you experience any of these, as retinal detachment can lead to permanent vision loss or blindness if not treated promptly.
So definitely something you wouldn't want to wait on. Okay, next up is conjunctivitis.
Right.
which I think most people know as pink eye.
Exactly. Conjunctivitis is an infection or inflammation of the conjunctiva, which is the thin, clear membrane that lines the inner surface of the eyelid and covers the white part of your eyeball.
Okay.
It's like the inner lining of your eyelid getting irritated.
Okay. And what are the usual causes of that?
So the causes are typically viral infections, bacterial infections, or allergies. Each can present with slightly different SNS.
Okay. And what are the telltale SNS?
So the classic SNS are a red or swollen conjunctiva, that's where the pink eye name comes from, an itchy eye, and often a discharge. This discharge can be purulent, meaning thick and pus-like, especially with bacterial infections, or more watery with viral or allergic conjunctivitis.
Okay. Moving on to ectropion and entropion.
Okay.
Those sound like they relate to the eyelids themselves.
They do so. Ectropion is when the lower eyelid turns outward, away from the eyeball.
Okay.
This can cause the eye to become dry and irritated because the tears can't spread properly. Entropion, on the other hand, is when the eyelid turns inward, causing the eyelashes to rub against the surface of the eye.
Okay.
This can be very irritating and can even scratch the cornea, the clear front part of the eye.
Neither of those sound very comfortable.
No, they can be quite bothersome.
Okay, next we have cataracts. I know those are quite common as people age.
Yeah, so cataracts involve the excessive growth of the epithelial layer of the lens inside your eye.
Okay.
Think of the lens as the focusing mechanism of your eye, like the lens of a camera. Over time, this lens can become cloudy or opaque, making it harder for light to pass through and leading to blurry or distorted vision. It's like the camera lens gradually getting foggy or scratched.
So what are some signs that someone might be developing cataracts?
So the main SNS are a gradual decline in vision, which might make things look hazy or less sharp and seeing halos or bright rings around lights, especially at night.
Okay.
In some cases, the cloudiness of the lens can actually become visible as a whitish or yellowish discoloration in the pupil.
Okay. And are there different types of cataracts?
Yes, there are. So senile cataracts are the most common developing with age. Factors like smoking, being overweight, having diabetes, and long-term exposure to UV light can increase the risk of developing them.
Okay.
Congenital cataracts, on the other hand, are present at birth or develop in early childhood. These can be caused by infections that the mother had during pregnancy, such as rubella, German measles, syphilis, or CMV cytomegalovirus.
Okay. And then there's presbyopia. How does that differ from cataracts?
So presbyopia is a completely different process from cataracts.
Okay.
It's an age-related condition where the lens of the eye gradually loses its flexibility, making it harder to focus on close-up objects.
Okay.
It typically starts to become noticeable in older adults, usually in their 40s and 50s. It's not about the lens becoming cloudy, but about it becoming less elastic and therefore less able to change shape to focus on things that are near. Think of it like the zoom lens on a camera becoming stiff and not being able to adjust easily.
That makes sense. Now let's talk about refractive errors like myopia and hyperopia.
Okay.
Which I think are pretty common.
They are. So myopia or nearsightedness happens when light entering the eye focuses in front of the retina instead of directly on it. This usually occurs because the eyeball is slightly longer than normal.
Okay.
As a result, people with myopia have clear vision when looking at things up close, but distant objects appear blurry.
Okay.
Hyperopia or farsightedness is the opposite.
Okay.
In this case, light focuses behind the retina, often because the eyeball is a bit shorter than normal.
Okay.
This typically results in clear vision for distant objects, but things up close appear blurry.
Okay.
So in myopia, the focal point is too far forward, and in hyperopia, it's too far back.
That's a good way to think about it.
Yeah, so it's all about where the light is focusing.
Okay. You also mentioned strabismus and amblyopia.
Right. So strabismus refers to a misalignment of the eyes, where one eye looks straight ahead while the other turns inward, outward, upward, or downward.
Okay.
It's often called crossed eyes or wall eye.
Okay.
Amblyopia, or lazy eye, develops when the vision in one eye doesn't develop normally,
Okay.
often because the brain favors the stronger eye.
Okay.
If strabismus or other vision problems in early childhood are not corrected, the weaker eye can become amblyopic. And if left untreated, amblyopia can unfortunately lead to permanent vision loss or blindness in that eye.
That's a scary thought, especially when you're talking about kids' eye health.
Yeah, it's really important to catch these things early.
Okay. And then we have a pretty straightforward definition, blindness.
Yeah, so legally, blindness is defined as having vision that is worse than 2200,
Okay.
even with the best possible corrective lenses like glasses or contact lenses.
Okay. Let's talk about a sty. That's something a lot of people have experienced, and they know it can be really annoying.
Yeah, a sty is a localized bacterial infection that develops in one of the oil glands near the root of an eyelash.
Okay.
It typically appears as a red, swollen, and painful bump on the edge of the eyelid, much like a tiny pimple. The most common bacterium responsible for styes is Staphylococcus aureus.
Okay, and keratitis, that sounds like another inflammatory condition.
It is. Keratitis is an inflammation of the cornea, which is the clear, protective front surface of your eye. It can be superficial, affecting just the outer layer of the cornea, or it can go deeper into the corneal tissue.
Okay.
A very common cause of infectious keratitis is the herpes simplex virus, or HSV,
Oh, wow.
the same virus that causes cold sores.
Interesting.
Other infections and injuries can also cause keratitis.
Okay, what about uveitis?
So uveitis is inflammation of the uveal tract, which is the middle layer of the eye. This tract includes the iris, which is the colored part of the eye that controls the size of the pupil, the choroid, which is a layer rich in blood vessels that nourishes the retina, and the ciliary body, which produces the fluid inside the eye and helps with focusing.
Okay.
The causes of uveitis can be varied, including infections and autoimmune disorders, where the body's own immune system mistakenly attacks healthy tissues. So lots of different things can cause that.
Okay, and what are the SNS of uveitis?
So the SNS can include redness of the eye, irritation, or pain in the eye, increased sensitivity to light photophobia, and seeing floaters, those dark specks that seem to drift in your field of vision.
Okay.
Blurred vision can also be a symptom.
Okay, next up is subconjunctival hemorrhage.
Okay?
That sounds
Yeah.
pretty dramatic, maybe even scary.
It can look alarming, but a subconjunctival hemorrhage is essentially a broken small blood vessel that bleeds near the surface of the eye, underneath the conjunctiva, which is the clear outer layer.
Okay.
It often appears as a bright red patch on the white of the eye. While it can look quite dramatic, like a spot of blood on your eye, it's usually painless and doesn't affect vision.
Okay.
It often happens spontaneously or from minor trauma, and typically resolves on its own within a couple of weeks, like a bruise fading.
Okay.
It's definitely one of those things in medicine that often looks much worse than it actually is.
Good to know. It's not usually serious. What about a corneal abrasion?
So corneal abrasion is a common type of eye trauma that involves damage to the epithelial surface,
Okay.
which is the outermost layer of the cornea. Can happen from something as simple as rubbing your eye too hard, getting dust, dirt, or a foreign object in your eye, or even from poorly fitting contact lenses. It's essentially a scratch on the surface of the eye.
So pretty common then.
Yeah, it happens quite a lot.
Now, proptosis and anaphamos, those sound like they relate to the positioning of the eyeball itself within the socket.
They do. So proptosis refers to the bulging forward or protrusion of the eyeball out of the eye socket.
Okay.
It can be associated with various conditions, including hyperthyroidism, specifically Graves' disease, which can cause the tissues behind the eye to swell, pushing the eyeball forward.
Okay.
It can also be a sign of ocular tumors or inflammation in the eye socket. The ophthalmos, on the other hand, is the recession or sinking back of the eyeball into the eye socket. This can occur due to trauma shrinkage of tissues in the socket or certain medical conditions.
Okay, finally, let's talk about diabetic retinopathy.
Okay.
I know that's a serious potential complication for people with diabetes.
Yeah, it is indeed.
Yeah.
So diabetic retinopathy is a condition that affects the blood vessels in the retina as a result of having diabetes. Over time, high blood sugar levels can damage these tiny blood vessels. In the early stages, known as non-proliferative retinopathy,
Okay.
you might see tiny aneurysms, which are small bulges in the blood vessels,
Mm.
and what are called cotton wool spots in the retina.
Okay.
These spots are areas where the nerve fibers have been damaged due to lack of blood flow. In the later, more serious stage, called proliferative retinopathy, the body releases vasoactive growth factors. Think of these as signals that tell the body to grow new blood vessels.
Okay.
However, in diabetes, these signals can go into overdrive, leading to the growth of new abnormal blood vessels in the retina. These new vessels are very fragile and can leak blood or fluid, leading to significant vision loss and even retinal detachment.
Wow.
Common SNS of diabetic retinopathy can include blurred vision and poor night vision.
Okay.
Sometimes in the early stages, there may be no noticeable symptoms at all, which is why regular eye exams are so important for people with diabetes.
Wow, we've covered a lot today.